Good afternoon, everyone. Thanks for joining us for our Les Encres webinar today. And if you're watching on a rewind, we appreciate you logging in and catching up on all the fun news that we have to offer. I want to introduce Michelle Byerly from the Aesthetic Nerd. Hey, Michelle,
Hi,
how are you
I'm
today?
pretty great. I wanted to introduce myself as a scientist, a trainer, somebody obsessed with skincare, and I'm really, really happy to be working with Les Encres. So let's kick it off. Let's talk about the coolest things that you have.
You are here today to talk to us about microneedling, and in particular, microneedling with the Procell device using our serums, which is the Renveau, the Liquid PDO plus J, along with Tendu, which is the polynucleotide that everybody is talking about right now.
Yes, I have been doing this for a while now because, of course, I love Liquid PDO. I've been a fan of Liquid PDO for a very long time, and the fact that Les Encres has made pretty much a revolutionary cocktail version. And with the pure polynucleotides, these two in combination is incredible. It's an incredible mix. I have
Mhm.
used it myself. I have my before and afters, which will show. And I using it with Procell, in my opinion, I have trained many, many people. One of the things I've seen is the controversy between the dragging and stamping method, whether we're going to drag and it doesn't cause any scars, but then some people are causing scars. In my opinion, Procell kind of eliminates that. You get to stamp it on the skin, you get to have it with no inflammation. I love that. Being able to push this product safely, incredible. Liquid PDO is fantastic for that, and polynucleotides are fantastic for that.
Let's pull up your before and after picture. And can you tell us a little bit about where you were when you first took this picture and how you got to where that amazing after picture is?
Well, I had just left the company that was stressing me. I think with everybody in skincare, actually, pretty much anybody in the medical world, we forget to take care of ourselves. And we're telling our patients, eat better, do better, care for your skin. And I didn't. I was so focused on educating and showing how well these products work without actually using it myself. So to be the person who advocates for things that I truly believe in, I used it. So I decided to use it. I used one of the best devices that I viewed around. Granted, not all representatives represent a product well, but I personally liked that product just because it's effective. I liked the liquid PDO because it's effective. I put them together and then I got my incredible results within a year.
How many treatments was that before and after?
It's 5 treatments. So, I did 1 a month, every month for 3 months, and then I kind of did it like any normal client would when I remembered. That was throughout a year, and 3 months later, I'm like, "Oh, no, I need my skin to be hydrated again." So then I did it again. I did it like any normal client would, so not evenly spaced out as possible in the last.
Okay, cool. So, real life application. And for all of the attendees listening to us today, you can tell why we've invited Michelle to come and give you some firsthand knowledge on the serums that we offer and then the efficiency of which Procell will deliver the microneedling process. But, Michelle, for those who are not incredibly familiar with our serums, can you break down what liquid PDO actually is and compares to using PRP or exosomes, for example?
Liquid PDO is essentially PDO. This is something that we've heard in the industry, and some people have a bad connotation of PDO threads, mainly due to technique. But PDO is a heavy type of, I consider it like a protein. It's a heavy type synthetic protein that our body takes a minute to digest. But my God, when our body does digest it, it has really good soft collagen. That's what we dream of, the soft, bouncy collagen with no fibrotic tissue. That is the dream. That's why I'm such a fan over the liquid PDO. I am a fan for PDO since for 12 years now. Pretty much what we did was put 1,000 PDO threads inside a vial with HA, which we already know with multitudes of products. Putting HA in the skin makes it look nice, plump, hydrated. So literally that, 1,000 threads, HA, two of the most powerful, safe driven, 40 years of research products in one vial. And then for Tendu, which is a polynucleotides is that salmon DNA. There are different types, two different types in the industry. There's PDRN and then there's PN. PN being the long, detailed molecule. Detailed molecule means that I could give you more instruction to repair in the skin. If it's shorter, which most PDRNs are a shorter or really diluted PN, which that's the false advertisement. It's a PN, but really, really diluted. Or actually PDRN, which is a broken fragment, cleaned very, very well, and has a shorter message, usually saying repair. This says repair. These are how you can repair. Here's some peptides, here's some amino, here's some vitamins for the skin. And having those two things together, lots and lots of food for that soft plumpiness, and really good instructions to utilize that and make that repair uniform. It's incredible. These two things are incredible.
So polynucleotides for the layman like myself really is like a skin blueprint. Is that a fair assessment?
Yes, yes. It's a blueprint and instruction guide. And it also has some peptides like a vitamin for your body. So it has a little
And how does one go about explaining these advanced products to clients without sounding
no. Well, again, PDO is going to generate a lot of collagen. It has a lot of food, so it has a lot of collagen. This is high quality collagen. If you're trying to explain it to a patient and you want to stack it with what you normally have, let's say PRP. PRP is a fast energy. It gives you energy now. It gives you good collagen, but it's short-lived. PDO is a longer-lived protein, so it would last 6 months, 4 months. If you want your PRP to have a boost, this is it. If you want to forego PRP altogether, no viability, none of that, having to make sure that person is viable. It's a very fast, effective version of getting a lot of hydration, a lot of collagen in 4 to 6 months. You have all of that time to have this particular product. That's how I place it in the PRP world. Tendu is kind of in the comparison of the exosome world, where you're talking about something that tells something what to do. That PN is really, really good at doing that. It brings a lot of circulation, oxygen to an area. It's just fantastic for that.
So, Michelle, I hate to interrupt, but we had an attendee log in with a question. Let me read this. If someone has dull, aging, or damaged skin, what stack would you recommend with Procell?
It would be, of course, a Procell treatment. Their skin is dull, so they need hydration. Both of our products have HA, so either one of them would be great. But if it's dull, they need more collagen, I would stack them both. I would use Procell. I would mix 2 mLs of Liquid PDO and 1 ml of Tendu. That would be my stack.
And it's safe to assume that all of these products are viable for all skin tones and types when used for after microneedling?
I would say yes, and it's the purest version. It is the purest version of all salmon DNA. That is the strongest version. If somebody does have some capillaries here, they tend to be really sensitive. PN brings a lot of circulation and oxygen. Sometimes it makes those little capillaries more pronounced. Not that it's going to kill your patient, but no patient wants to see their capillaries more pronounced. So I would just stick with Liquid PDO. If in doubt, all Liquid PDO. Anybody who walks into your office, Liquid PDO is your go-to. You don't have to worry about if they are a candidate or not. Liquid PDO is your go-to. Tendu is if it's, I need a little bit more help. They need more instruction. It's usually older skin that needs more instruction, but it works on everyone.
And how often should these be used after microneedling treatments? Do you need to space them out? What's the protocol there?
I would say just like I did, I got my results doing it once a month for 3 months, and then you could space it out depending on that person's skin. So if you see that they need a little bit more help, they're older, they haven't done treatments for 30 years, they've never done a treatment, they could do another round of the 4th month, or they could space it out every 3 months after their initial 3.
Okay.
So I always recommend 3.
And just get another question in. These are great. How do I price these stackable treatments in a way that feels premium but accessible? That's a good question.
I like to price it out like PRP. Whatever your PRP treatment in your area is, I think the liquid PDO, if you're buying the premium package, it's $1,000 for the premium package, which is just 10 vials. It makes it $100 a vial. With that, it's $10 an ml. That is the really, really low. And then you have PN, which is around $20 an ml. That's $40 of full treatment if you're stacking them. You're charging PRP prices, 300, 400, and some people charge more for their microneedling treatments and then less for the add-ons. Some people charge for the add-ons and less for their treatment. So it just depends. My go-to is whatever you would charge for PRP, you would charge for this product.
Okay. As a scientist, why would you tell people to trust Les Encres products in their practice over more hyped up or more public reaching brands?
Well, first, for the fact that I'm here, I definitely can explain it. I am the clinician that gets called. Pretty much anybody who has questions, I'm the one that everybody gets to send their clients to. So you actually get answers. There's no ghosting. I like in this company, there's like nobody's ghosting you here. And in the industry, that is a well-known fact, even for the most popular brands. It's the quick, I have a question, silence.
Mhm.
I don't do that myself personally. So the second that a rep does send you my way, I will answer every question and above and accurately. I think that that's another thing that you'll actually get the answers correctly. You get the full answer. And that's one of the reasons I trust this company. I have gone to trust and care for the fact that when I came in here, we spoke science, we spoke about these products, we helped make a lot of the clinical papers that surround it. We've talked clinical papers, like we've read clinical papers together. We have summarized these together. And that's what I build the trust around, companies that actually know the product. And that's a rarity in this industry, that people that just sell it have no idea what they're selling. And it could be
Right.
great, but they have no idea what they're selling.
Well, the cornerstone of Les Encres has always been safety, science, education, leadership, and heart. And I think you just summed that up without even knowing that's what you did. For the listeners who have not gotten to dig deep into serums, in a nutshell, what would you say the long term benefits of using regenerative add ons like our Renveau or Tendu instead of just using basic serums out there in the market?
Well, there's a lot of safety and efficacy issues. I think in the industry, I have seen quite a few products in the industry that it's just HA, or it's a lower quality product. Like I said, a very, very diluted version of anything that's effective. They put stem cells in lotions that it doesn't even make sense scientifically. It's just some like the buzzwords. I
Mhm.
absolutely hate buzzword products. This, again, are two very clean products. It's polynucleotide and HA and PDO and HA. There's no complicated mixes here. Additionally, in the just random serums out there, tend to have a really big laundry list of ingredients that sometimes those ingredients don't even work really, really well together. They're not intentional. Some of the patients are very sensitive to glutathione, and adding glutathione for certain products can agitate the skin. Having two very, very clean products makes it easy to pinpoint. If it's a laundry list of ingredients, you have no idea which thing agitated that person's skin, and then you blame that product or you blame that ingredient, thinking that that's what it was because it was a buzzword. I appreciate these biostimulators and these regenerative biostimulators because it's clean and it's pure and it makes sense. These two things are highly researched. They've been researched for decades. So this is
Mhm.
not a new invention. These two are very pure, well-studied products with not a laundry list of ingredients. That's why I like it. It's effective.
Okay. And speaking of newer inventions, you have mentioned Procell on a number of occasions as your primary go to microneedler. Tell us a little bit about why that is.
Again, I think it's for more of the stamping ability. For me, I like the fact that it's stamping. When you are dragging a needle, which I've seen on multiple occasions, whether it did not look like it caused harm, it does. So your body has to prioritize healing something. Is it going to be the surface or is it going to be the internal part of your skin? And I prioritize the inside of my skin Of course, we have peels for the outside. We can do like nano needling for the outside. We have HA for the outside of our skin. But for the inside, I like to focus things like this, these products that do cellular repair, that does collagen stimulation to a regenerative effect inside. I'd rather my body prioritize the inside, and Procell does a really good job at that stamping mechanism. Not to mention also it's ergonomic, so I don't have to sit there and hold it in that way. I can hold it like a gun, which also makes me feel comfortable. So that's one of the reasons I choose that product. It forces you to do the stamping method.
Well, Michelle, let's dive in and watch a training demo video right now.
Hey guys, Austin Phillips here with Procell Therapies, and welcome to the treatment room. Today we're going to be doing a facial treatment on Chastity. Our areas of concern are going to be some discoloration around the mouth, hyperpigmentation in the cheeks, and some scarring on the forehead. So today we're going to be using a 0.025 millimeter tip. These are individually packaged and sterile for each use and one-time application. To begin for the treatment, we're going to start, we've already done our double cleanse, and this will be a disinfecting pass with a 70% alcohol. Chance, go ahead and take a big deep breath for me. Make sure to breathe out and hold that for just a second. So this will be the facial mapping. So guys, while we're doing the treatment, we do break the face into sections. So first I'm going to begin in the forehead. I usually work in about a 3-finger section. So we'll complete this first half of the forehead, move into the side from the temple and the jawline, move upward through the cheeks, and then finally up underneath the eye. From there, we'll begin on the left half, so we'll begin, or the right half, sorry. We'll begin on the right side of the forehead, the right temple, the right cheeks. We'll finish up with the nose, the nasolabial folds, the lips, and the chin. So for that 0.25 tip, the easiest way to open these is there's actually a single perforated edge. We'll push the tip out into the corner and give it a good squeeze. To attach the tip, leave the tip in the palm of your hand, and you want to roll it on the device. When you remove the tip, you do not want to just pull it directly off. You want to roll the tip off as well so that you could not possibly damage the push rod. You'll want to expose this and show it to the client to show them that this is a sterile tip. It has never been used before. And we'll see that we have 25 microfilaments at the depth of 0.025 to begin our treatment today. Since we did disinfect the skin with alcohol, of course that's known to dehydrate the skin, so we will rehydrate just slightly utilizing our growth factor serum. Like we discussed, that first section will be the first half of the forehead, so a quick pass of the serum just to moisten the area. Set that off to the side. And our device on the back is going to have 2 preset speeds. So on the low setting, it's a single clockwise turn. And for the high setting, it is 2. We let the weight of the device sit on top of the hand, and our elbow will be in a perpendicular motion to ensure that our stamp is totally flat every single time. You do not want to be setting your wrist down and utilizing this as your tip will be on an angle. When we're treating, we want to pull the skin nice and tight, so we want to always have a taut temperature. And we're going to do 5 stamps and a 50% overlap. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. From there, we're going to overlap. So we're going to overlap by 50% and then work our way right back down. Tilt your head to the right for me. To the right. There you go. And that will complete our first section. Put our device off to the side. And now that those channels are totally open, we have kick-started that wound healing cascade by opening up these channels Now we're going to flood it with our growth factor serum to maximize that rejuvenation process. From here, now our next section again is going to be right through the temple. We're going to work our way directly down the jawline to outline our next area. So again, a quick pass with the serum, just to moisten up from that alcohol pass. Tilt your head all the way to the right for me. Perfect. Device back onto the high setting. We're going to pull down on the neck here. So areas where if you're treating enlarged pores or acne scarring, making sure the skin is pulled very tight is going to dramatically increase your result. Picking back up with that same 5 stamps and 50% overlap. So now we've outlined that full area. Chest, go ahead and fill your cheek with air for me, please. Perfect. This is going to be an excellent stretch to assist in bringing up any acne scarring or enlarged pores. And just like that, our second section is complete. Again, we're going to take advantage of those open channels, flood them with our growth factor derived serum, maximize rejuvenation. Chest, how does your skin feel?
Good.
On a scale from 1 to 10, was that painful at all?
Not really.
Not really?
It wasn't bad.
Good. So with this treatment, it's safe enough to work on all skin types, and we don't need to use numbing cream. Our downtime is only 90 minutes, as opposed to multiple days with typical microneedling. Our next section here is going to be focusing on the eyes. So with this treatment, it's actually safe enough to get all the way up underneath the lashes, and today we're also going to be going over top of the eyelids. When you have contacts that have clients that have contacts in their eyes, I do dial down to the lower setting to reduce the chances of watery eyes. So this will help with being able to stretch the skin. So Chest, lift your chin up for me, open your eye, and look just slightly over to the right. Perfect. We're going to pull down on the cheek. When you're treating fine lines and wrinkles, especially underneath the eyes, you want to make sure that you're causing just enough inflammation to see a moderate difference in the lines underneath. So look into the camera right here for me. Can you see a little bit of difference just from the swelling underneath? That's going to be our indicator that the area's been treated well enough. So let's go ahead and get that serum in. We'll obviously go over our previously treated areas with the serum as well so that we can layer over top. And now we'll actually go over top of the eyelid as well. For this one, again, I do like to keep it on the lower setting just in case for chance of any watery eyes. We'll pull back on the eyebrows and we're going to follow that orbital rim. We're going to be using gentle taps since the skin here is very thin and we don't want to have any chances of bruising. Relax your eye for me. Good. Perfect. And then again, we'll follow up with that serum.
When is this close enough?
You can relax your cheek. So for the last area that we're going to treat, due to our disinfecting, if there is any bacteria left on the face, it's probably going to be right around this region. So for our very last section, we're going to complete the nose, the nasolabial folds, the upper lip, and the chin. For the nose, this is one of those kind of tricky areas. So you always want to make sure to pinch the tip of the nose because the intense vibration from the device can leave your client feeling like they need to sneeze or cough. So Chess, if you have a sensation of needing to sneeze or cough, please give me a hand raise and don't sneeze into the device, okay? All right, so we'll pinch the tip of the nose. We're gonna go directly down the bridge. And this is a really great area if you have enlarged pores around the nose. You want to pinch and stretch over this way. Look over that way if you can. So you want to pull the nose to the side. We're going to follow down, inwards, and then back up to the eye so we can get that little area that we may have missed. Look over all the way to the opposite direction. If you want to come over on this side, I'll wait for you.
I'm gonna sit right
Okay. Good. Look straight up, to the left. Curl your lips. Perfect. So we're going to pull these straight like that. And then from here, Procell is an excellent treatment for combination therapies. When it comes to post-treatment, one that I really like to operate with is a red light LED before we put on our hydrating mask. So the final step of this treatment, once this serum vial is done here, is going to be that hydration mask. The importance of hydration post-treatment is because a lot of times when you're microneedling or causing any form of micro-injury to the skin, it's very common to peel or flake. This is known as transepidermal water loss. So the hydration from this mask is going to help fend off transepidermal water loss and leave the skin hydrated and fresh. So this would be our Procell Therapies hydrating mask. We'll open this, and honestly, this is probably one of the hardest parts about the treatment. These masks are extremely dense and saturated with hyaluronic acid. Let's see if we can manage to get all these flaps today. Curl your lips for me. Good. So if we were doing that red light LED, we would have put that LED on before this mask. The reason we would do that is because since this mask is so densely concentrated with that hyaluronic, once that seeps into the channels, that red light would essentially be a little bit useless and ineffective. So we would put that red light on first, followed by this mask, and this mask will sit on for about 5 to 10 minutes to complete our treatment.
Excellent. And for people who are interested in getting started offering high-end regenerative treatments like this, where do they start?
I would get a good medical device. If you are sticking with a doctor pen, usually those are not consistent when it penetrates the skin. I would get a good microneedling device, pretty much this webinar. It's going to be $1,000 off that normal price of a microneedling device, which is something that they're offering because I am the trainer and because we're doing this webinar. We also have a sale for our serums. I would start with these. Liquid PDO, if you're just going to pick one product, just one, I would say Liquid PDO because that's an everybody product. Tendu, I love that product too. It's for cellular repair. It tells your body what to do with that newfound food that you just got. These two are the main bread and butter of regenerative medicine. These three things are great. If I just had to select just two things, it would be the Procell device and Liquid PDO because I'm a huge fan.
Okay, so just to make sure I'm understanding this correctly, anybody who purchases from this webinar today a vial of Tendu or Renveau receives $1,000 off your Procell device?
Yes.
Wow. Okay. Well,
Or either one of the devices, the Pro or the MD, they will get $1,000 off. This is the most affordable time to get this device. This is the biggest sale they're ever going to have. So we get to take advantage of that especially with these products.
Well, and of course, as always, if you have more questions about Tendu or Renveau, you can always log on to our practitioner portal. And the practitioner portal has hundreds of clinical white papers, training videos, sales support, marketing tools, Instagram and social media posts, any and everything of Les Encres library-wise for you to access is there on our practitioner portal. Any closing thoughts, Michelle?
I do want to bring up as well, if you do end up buying a Procell with me, I actually train you on how to use that device, as well as train you on how to stack this with literally anything in your office that is something that is only offered exclusively through me. So I actually get to train you on exactly how to do this because, of course, I was in the help of the development of these products too. So if you're like, hey, I really need to know exactly how to mix this, I will work that with you.
Is there a fee for that train?
No, it comes with just purchasing the device. So if you purchase the device and you purchase the product, I will show you how to use that. I'll train you on exactly how these work on the molecular level and the cellular level. And that comes with just getting the device from me.
All right. Well, thank you, Michelle, for your time today. Thank you, everybody, for logging in and watching this very informative webinar on serums and microneedling. Thanks a lot. Bye-bye.